Hey everyone, hope Costa Rica is going really well. I have a few things to say about how it shaped my career, and it certainly did. Big thing was experiencing healthcare in a different language. I grew up speaking English in an English-speaking country, and I never really had to feel the anxiety and the worry of not understanding what was going on with my healthcare. And I kind of felt that while shadowing doctors in Costa Rica. I felt I don't know what's going on. I felt I hope he's okay, but I can't understand this. And so it made me much more empathetic to people who don't speak my language. And I think as a doctor, I will never forget the feeling of being on the other side of the table whenever I'm treating somebody that doesn't speak English. Seeing how they can do good medicine for so much cheaper was really inspiring. The United States spends so much money on healthcare, and their outcomes aren't much better and sometimes even worse than Costa Rica. And it kind of inspired me to go into healthcare policy to see if I can fix that. Most importantly, seeing their community engagement was so inspiring. The way that whenever we were there, we walked with nurses to go vaccine families door to door, and we could just walk in their homes. They were welcoming. They sometimes try to give us snacks, and they were answering the nurses' questions honestly, and were being so, upfront and clear about their vaccinations, and they were willing to take vaccinations just from people walking in their homes. And I can never imagine that happening in America. I also loved how they taught the kids how to wash their hands right, how to, keep good hygiene, how to really take health into their own hands with diet and hygiene. Um, so it made me want to, as a healthcare provider, try to bring that Costa Rican love into practice by teaching my families how to take care of themselves, how to teach their kids to do the right thing from a young age. And I want to, and I'm inspired by the community relationship that healthcare in Costa Rica has with the population. They're very close, they're very connected. It's not like the majority of the United States where it feels like it's us, the people, versus healthcare and versus hospitals and doctors and providers. The sentiment is quite the opposite from what I saw in Costa Rica. People trust their institutions and they're willing to listen and follow the guidance of providers and of their national health institutes. So all in all, Costa Rica was really humbling. It was eye-opening and it was inspiring for me to bring a little bit of that Costa Rican love to America as a doctor. Thank you. I hope everything goes amazing.